Could us parents see changes on which vaccines and how many are recommended for our children? Members of the CDC's Vaccine Advisory Committee are suggesting looking into aluminum salts in vaccines after a statement on the CDC's website said the Department of Health and Human Services was looking at whether aluminum in vaccines could be linked to autism. Akron Children's Chief Quality Officer, Dr. Michael Bigham, joins me now to share more on what local doctors are advising to parents and patients and addresses some of those concerns. So, Doctor, thank you for taking the time.
Thank you for having me.
Yeah, why are aluminum salts used in vaccines and what are they?
Aluminum salts they're added to vaccines, and I think of them very simply without getting too sciencey. They basically let the body know that they need to respond to the vaccine. It's not it's sort of like a knock on the door that lets the body know to open the door, to get ready to respond to the vaccine, which then builds the immunity to that illness or exposure in the future.
Okay, we've seen discussion about potential dangers by the president and the Secretary of Health, insinuating maybe they're not safe. I'm wondering if there's any research that supports that claim and what you've seen in recent studies.
There is research, and it gets complicated I know for families to try and navigate this. I'm a parent in addition to a physician, and I think we get worried when the messages are mixed and confusing. And so there is research about the aluminum adjuvants, and that research in a large study out of Denmark has shown no concern for those other than that they help the vaccine be more effective, but that they have no long-term or short-term consequences to children other than enabling the body to respond to those vaccines.
Do you expect them to eliminate them from vaccines based on what you're hearing, or do you think it's too early to know?
Oh, I quit predicting a long time ago what might or might not happen. I can just maybe provide some reassurance to you and to your listeners that physicians are scientists as well. We would never expose our own children or our patients to anything that we felt was unsafe for them. And so we spend a lot of time doing our due diligence to do our own review of the scientific literature. And we make changes. We have made changes in the past when the science indicates it. But I think that's where I would encourage your listeners to just have an open conversation with their healthcare provider, where we can try and sort of maybe silence the confusion that's out there in the media, but rather really try and just have an honest conversation about the science and what we think is best for your kids and your family.
Okay, and the CDC Vaccine Advisory Panel, they were arguing at their last panel meeting about possibly adopting a vaccine schedule similar to Denmark. Talk to us about how maybe that's different from the childhood vaccine schedule and what Akron Children's also follows.
Yes, I mean, Denmark does have a different vaccine schedule. I'm not certain why Denmark is the model to pursue, other than they do require fewer vaccines. But I think if you look at many other nations, they require a similar vaccine schedule to the U.S. And I think, frankly, vaccines should be tailored to the public health needs. And Denmark's just very different than the U.S. There's about 55 times more people in the U.S. Our illness prevalence is very different. And so to think that what works in Denmark is precisely what would work in the U.S. is just probably imprecise. And they have different motivations as well. They're a national healthcare service, and they might be looking very closely at the cost effectiveness of those vaccines. And that's just different than what we're looking for, which is the safety and health of the children we take care of.
And does Akron Children's have its own schedule, or would you say all pediatric offices across Ohio do the same thing?
All pediatric offices recommend the same thing, and it's been a long-standing vaccine schedule that gets reviewed thoughtfully and updated based on the illnesses that our kids can potentially be exposed to and how we can keep them healthy and safe.
All right, it's a lot to learn, so thank you for taking time to join us. I think a lot of us parents are just trying to figure out what to do next and how to plan ahead, so thank you for being with us.
Thank you very much. I appreciate it.